name is Ma.Bernadette, and I'm a student from Salamanca. I'm a student from Southwestern University, Vial, and I'll be your resident nurse. So what I am going to do is I'm going to perform preparation or cover preparation for medication for Vial. So the first thing I'm going to do is I'm going to prepare hygiene. And hygiene is very essential for us to control the spread of microorganisms. Then will be hand hygiene. Now I'm going to proceed with
After
the
that is
preparation of my I'm going to
verify the medication on the vial and the medication on our patient's chart, and then also
I'm
adhering
going
to the
to
guidelines of
use
the administration.
and the materials are already settled. Now I'm going to proceed with the dosage calculation.
Next is proceeding to the dosage calculation as needed on the patient and medication.
So for
And then after that is we're going to be
I'm going to remove the top. I'm going to remove the top seal of my vial. Then by using cotton balls, I'm going to disinfect the top or dust up rubber of my vial.
next is we're going to be removing the top seal or the thin cap seal of our vial, and also must be careful not to touch the rubber stopper, and also using a pad or swab to clean.
This seal is my
And also read the instructions of the vial of how much or the amount of the you're going to be using.
so let's
Also
take a
the
look to check for the expiration date of the materials that we're using. And it's very essential also to follow the checklists. This is the right patient, right qualification, right dose, right route, time, documentation, response, reason, and the education and the patient's right to refuse.
So I have here my
Since I am
SIC.
mistaken with the I'm mistaken by the opening of my syringe, I'm going to use this one because this is already contaminated, so I'm going to dispose this one.
Since we're going to be diluting,
Make sure that this is tightened.
and then in diluting, we're going to be adding our NSS or cell water to our vial. Still the same procedure. Then dilute. then in here is we're going to be slightly slanting our needle with the tip first, or the bevel up first, and then inserting it into the vial, instilling the air just above the fluid sample of our vial. For doing so is I'm going to be taking my non-dominant hand, which has the vial, and then turning it up. Then using my dominant hand to pull back the plunger and add the solution into the syringe. And then if it happens that there is an air or there is air present in our syringe, we're going to be flicking our syringe barrel. If it happens that our syringe has air, we're going to be flicking it, pushing back the air, but careful that we do not expel any of the solution. And then add solution if possible. Afterwards is
Now we're going to mix this inside of our vial.
and then note that if bubble is still present in our syringe, we're going to be holding it vertically and with the needle attached, and then pull back the plunger, and then flick the syringe. Afterwards is push back the air and release the air. So, but careful that we do not spill any of the what's inside of the syringe. After that is we're going to be rechecking the label and our medication. Checking the vial or the medication. We're also going to be comparing it on our medical chart of the patient if it is the right dosage. And then we're also going to be replacing our needle if the ones that is used to get the medication of the vial is irritating to the tissues. And then next is we're going to be labeling, of course, our drug, and then the drug amount inside of our vial, and then dispensing, and then add the syringe, the additional cotton swab, and also the medication chart on the medication tray or the tray of our patient, our patient, and then we're going to be disposing, discarding, and restoring of the ones that we're going to be using and not using anymore.
Now it's already
After doing so, we're going to
the
form
that we
a
have the right dose. For this horizontal, if there are any bubbles, let's discard all the bubbles by flicking.
that would be all. Thank you.
When it's already settled, let's dispose taking. Now we're going to label our syringe into a quarter at a time. And what is the name of the medication that we are having? Then we're going to document the findings, and we're going to apply